Bismillahirrahmanirrahim. Assalamualaikum and good day to everyone. Thank you for being with us in this presentation. First of all, I would like to thank the organizer for giving us this opportunity to be part of this conference. I hope that with this presentation, we can share something and benefit the viewers in whatever way we can, inshallah. Ladies and gentlemen, before we proceed with our presentation, please allow me to introduce a bit about our team. Our team consists of three members. I am Ahmad Rafeein bin Mohamad. I am a postgraduate student at the Faculty of Leadership and Management, Universiti Sains Islam Malaysia, Nilai Negeri Sembilan. And the other two members are Dr. Kalsum and Associate Professor Dr. Khairuniza Muhammad Noor, and they are currently academic members at the respective faculty. Now let's proceed with our presentation. This is basically a concept paper and its title as per mentioned on the slide. It is basically to present a framework to examine the public doctor's turnover intention and how organizational justice links to it via a mediation of the organizational citizenship behavior, OCB, and a moderation of the personal norm of reciprocity. I hope that everyone can follow the presentation accordingly with the outlines on the slide. First of all, let's develop our understanding on what we call as the Universal Health Coverage or UHC. It is basically a movement brought by the World Health Organization, WHO, with the purpose to provide to all people an open access to health services they need, regardless of their localities and financial capabilities. In moving toward UHC, WHO has set the agendas for the country members to prepare an adequate and competent healthcare workers, particularly to make sure that health workers have necessary medical skills and they are equitably distributed across geographical areas and communities. This is due to the importance of sufficient and evenly distributed workforce density to achieve UHC, as what has been emphasized by Cometo et al. 2020. Ladies and gentlemen, under the Malaysian Federal Constitution, the Ministry of Health is responsible for all the required and necessary matters regarding the medicine, health and sanitation in the Malaysian Federal Capital, in which the medical personnel under the respective ministry are providing the widespread healthcare services nationwide. In that particular system, universal and comprehensive medical services are provided with a minimal cost, and it is continuously backed up with a strong financial protection by the federal government since independence in 1957. Therefore, to achieve UHC, Malaysia aims to increase the Rakyat Health Index by the year 2030 through several strategies, which include the expansion of capacities for healthcare facilities and workforce under the 11th Malaysia Plan 2016-2020 and the development of a connected healthcare system under the Shared Prosperity Vision 2021-2030. The objective of this initiative is basically to manage the disparity or polarity in healthcare services, especially in underserved areas, so that people from different regions, origins, age groups, and social background would equally benefit from the enhanced healthcare service delivery system in the country. However, it seems that Malaysia is facing a big challenge, especially in fulfilling the need for adequate health personnel, especially among the public medical doctors. Based on records, the resignation rate among doctors from the civil service is relatively high, and it has increased over years. This issue has caused some unfavorable consequences to the country, such as the imbalanced distribution of doctors between the public and private sectors, shortages of medical doctors, especially specialists in the public hospitals, and many other issues. It has been highlighted that due to shortages of specialist doctors in the public sector, the public hospitals had to cater to 70% of the country's acute health cases, while only compose around 30% of the country's medical specialists. Ladies and gentlemen, the question may arise here: what are the root causes that motivated the public doctors to make a move to other entities? Basically, there are a few studies, as I mentioned on the slide, that have discussed about the issue of job satisfaction and turnover intention among public doctors in Malaysia. In those studies, issues like low pays, heavy workloads, poor recognition, effort-reward imbalance, lack of promotion, and many others were highlighted, and those issues were among the factors motivating public doctors to show a low job satisfaction and a high turnover intention. As far as the concept of organizational justice is concerned, those issues are reflective or indicative to organizational injustice. Based on the organizational justice conception, it may be observed that the issues that I mentioned just now could reflect a low justice perceptions. However, we could observe that there is a lack of research interest given on the issue of organizational justice in the Malaysian public health sector. And to our knowledge, no specific study found to measure organizational justice, especially among medical doctors. Therefore, we would say that organizational justice in particular and its effect on the turnover intention among the Malaysian public doctors are uncertain and still underexplored. We have also seen that many of the existing studies testing the organizational justice models were limited to its distributive, procedural, and interactional justice components, whereas the temporal justice component is not addressed, especially when it comes to the prediction of turnover intention. In addition to that, there is a review about the organizational citizenship behavior (OCB) by Digas et al. 2020. This study discovered that many studies have looked into the positive outcomes of it, but there has been a little research on the negative consequential effects of OCB, and increasing turnover intention might be part of its negative outcomes. Therefore, we propose that further study should also venture into this segment, as it could test whether public doctors in Malaysia have a certain level of OCB and how it could relate to their turnover intention. As far as the existing knowledge on the linkage between the proposed variable is concerned, we conducted a literature review accordingly. Based on the literature review, it is discovered that previous study have empirically given proof that those variables are correlated to each other. Thus, we conclude that there are evidences to say that, firstly, there is a significant inverse direct correlation or relationship between organizational justice, which means that when there is an increase in organizational justice perception, turnover intention will decrease, and vice versa. Secondly, there is also evidence to emphasize that there exists a significant effect between organizational justice and OCB, and between OCB and also turnover intention. And finally, turnover intention is accepted as an outcome for organizational justice and OCB, and at the same time, it could become a factor for the actual turnover, in which the stronger the turnover intention is, the stronger the actual turnover behavior will be. Here, we would like to share about the theories that underpin the linkages between the variables. In the overall perspective, the relationship between variables may be seen from the lens of the equity theory, justice judgment theory, social exchange theory, and the theory of planned behavior. According to those theories, people are judgmental on the benefits they are getting from their exchange partners once they believe that they are receiving fair outcomes as compared to what they have contributed, or in comparison to what others around them are getting, they will perceive that they have been fairly treated. As a consequence, they will perceive a fair and rewarding relationship with their exchange partners. Then that perception will be followed with a feeling that they should reciprocate other people with good reciprocal behaviors. And several studies have determined that the reciprocal behavior might be in the forms of increased level of OCB and also a lower intention to live. Based on the previous research finding, it can be concluded that there is a direct association between organizational justice and turnover intention. However, research has shown that their relationship might change due to intervention by certain variables. And it is commonly accepted that to test the mediation effect, a causal chain between the independent and dependent variables is required. However, Guinness et al. 2017 argued that testing a direct relationship between both variable in mediation analysis violates the basic principle of parsimony and prompts the researchers to examine models that are not aligned with the theory. In addition to that, Memon et al. 2018 said that it is no longer relevant or necessary to test the direct relationship between those two variables before or after analyzing a mediation effect. So according to the authors, regardless of the relationship between independent and dependent variables, the researcher should test the mediating effect. As far as the variable for the present study is concerned, it may be posited that the most central condition is that the mediation analysis sticks to the rules of whether or not organizational justice affects OCB, and in turn, OCB affects the turnover intention. And whether or not organizational justice has a significant relationship with turnover intention is no longer a concern. Ladies and gentlemen, the equity theory and Uhara 1995 depict that people tend to benefit from their exchange partners. In this situation, they might undermine the principle of justice and balanced reciprocity, and perhaps it could give unfavorable impact on OCB and subsequently on turnover intention. Based on this, a moderating variable with its function to strengthen, weaken, reverse, or change the nature of relationship between the variables might need to come into the picture. Therefore, we are recommending that the personal norm of reciprocity is included in the framework. It is expected that with a strong internalized reciprocity norms, it could mitigate the negative impact of perceived injustice on OCB and at the same time helps in the reduction of the intention to live. Ladies and gentlemen, based on the rules of basic mediation framework as proposed by Auguinis et al. 2017 and Maimon et al. 2018, and the rule of moderation effect in modifying the interaction between variables, we are proposing a conceptual framework consisting of OCB as the mediating variable and the personal norm of reciprocity as the moderating variable. And focus is given on testing of indirect relationship so as to examine how a mediator and a moderator could develop a linkage between organizational justice and turnover intention indirectly. And hence, we are proposing 4 hypotheses that are self-explanatory and presented on the slide. In terms of the significance of the study, I think that the proposed framework is important because it could further expand the body of knowledge regarding the framework of justice, especially with the inclusion of the temporal justice as part of its component. As a result, a 4-factor model of organizational justice may be developed, particularly in a healthcare context. And it will also provide new discoveries regarding the role of OCB and the personal norm of reciprocity in an integrated model that linking organizational justice to turnover intention in an indirect relationship. And last but not least, the proposed framework may provide an avenue to test and verify the significance of the parsimony principle in the theory building when the focus is given on testing the indirect linkage between organizational justice and turnover intention, while their direct linkage is omitted by the study. As a conclusion, we believe that the proposed study is important not only for academic work, as it could further extend your knowledge regarding justice and other related components, especially within the healthcare context. But this study is also important for the stakeholders. Firstly, to determine the state of doctors' tendency to leave their organization, so that it could help in addressing the core issues contributing to public doctors' migration. And at the same time, the stakeholders could plan and design appropriate managerial strategies to deal with the issues more effectively. Secondly, throughout the study, the public doctors may conduct self-evaluation on their tendency to leave, and at the same time, they may also encourage loyalty and esprit de corps among them. And thirdly, it is hoped that the study could develop a model of linkage between organizational justice and other variables that may explain the scenario of organizational exchange in the Malaysian public health sector more comprehensively. I think that's all our presentation. Last but not least, I would like to thank everyone for giving your attention to this presentation. I would welcome any observation and recommendation to further improve this proposed concept paper. With that, I wish everyone a blessed day ahead and thank you for your attention.